Hi, thanks for joining me. My name is John Pilcher. I'm a bariatric surgeon in San Antonio. I plan to talk about a series of topics that have to do with bariatric surgery with a particular focus on the metabolic aspects of obesity. The concept is that we're talking about metabolic obesity disease. And metabolism means that we're talking about an abnormality or an imbalance in the body control systems. This is something that happens here and it doesn't happen here. The old school way of thinking about it was that excess weight was a problem with choice or a problem with habit or a problem with will. And that never did fit with individuals' experience with weight loss because most people can lose weight when they try to be on a diet or try a lifestyle change. And what they're doing in that situation is they're using their will and their consciousness to defeat the automatic control systems. This can last for weeks or months and people can have transient success. But after a while, the will is shaken. Maybe it's a medical event, maybe it's a life event. And once the will weakens or loses focus, then the metabolism and the body control systems take over again and the weight comes back to where the body thinks it's supposed to be. Now, there are probably many different reasons for the biological control system to get out of balance. And it's still being researched exactly what's going on, but a useful way of thinking about it is that people have a fat thermostat inside their body. And the body thinks that it needs a certain amount of fat to be healthy. Now, it's true that a certain amount of fat is healthy for the body, but for people with a weight problem, that control system gets out of balance so that it either doesn't recognize how much fat is actually there, or it comes to feel or comes to select that there needs to be an excess amount of fat. And the body will actually fight to preserve that excess fat level over time. Most people have had the experience of using their will or their focus to bring their weight down, and they've noticed that when they cut down their calories, that their metabolism will close down or reduce as well. This is actually a natural response when you understand that the fat thermostat is fighting against the weight loss. Now, it's useful talking about the metabolic concept of obesity for two main reasons. The first of these is that we want to try to let go of a little bit of the guilt that goes with excess weight. The way we've all been taught about obesity is that people have a weight problem because they're weak-willed or they lack focus, and that turns out not to fit with the current research. So the fact is that people who suffer from excess weight have a biological imbalance that was not a matter of choice or a failed matter of will or habit. The second reason for using a metabolic focus for this conversation is to understand that whatever treatment we use for the excess weight, whether it be surgery like a gastric bypass or a gastric sleeve, or medications, or hormone changes, or lifestyle change, the intervention needs to get to the core problem, which is the imbalance of the control system. So we need to reset that fat thermostat in a way that lasts. Thanks for watching today.